Today I'm going to be talking to you about a very uncommon cause of a homonymous hemianopsia or cortical visual impairment that comes to neuro-ophthalmology, which is Cadasil, which is cerebral. It's autosomal dominant, which means they often have a family history of stroke. And it's an arteriopathy because it looks like stroke, but it's not really arteritis, and it's not really going to be like a typical type of stroke. And it's going to be subcortical infarcts with white matter disease, leukoencephalopathy. So this is Cadasil, cerebral autosomal dominant arteriopathy, subcortical infarcts, and leukoencephalopathy. And you should be thinking about it in stroke in a young person, especially if their typical stroke workup is negative, no atrial fibrillation, no cardiac disease, no hypercoagulable state. We're going to be thinking about it in younger patients who have a family history of stroke, and the MRI scan usually shows a very characteristic bilateral and symmetric temporal lobe white matter hyperintensities in the subcortical leukoencephalopathy pattern. And the test, because it's autosomal dominant, is the mutation in Notch3, which is involved in arterial development. So whenever you're seeing a young patient with a stroke, if the MRI scan shows bilateral temporal white matter leukoencephalopathy and subcortical infarcts, family history, autosomal dominant, you should be thinking about Cadasil, cerebral autosomal dominant arteriopathy, subcortical infarcts, leukoencephalopathy, and the test is for the mutation, the Notch3.